Hello, my name is Angelica Gonzalez Almanza and I will be a sophomore this coming fall. I major in global public health with a minor in community action and social change. Last fall, I participated in the course of cultural anthropology that had a service learning aspect to it. I chose to do my service learning at the Ritter Center, a local food pantry in San Rafael. The Ritter Center's mission is to prevent people from becoming homeless and improve the health and well-being of individuals and families who are low income or homeless. The Ritter Center does this by giving them access to medical care and social services. The programs that they offer are primary medical care, behavioral health counseling, transitioning to wellness, and dental programs. The larger context would be to reduce the homeless population in Marin, but also to provide them with the resources necessary to get back on their feet. At the Ritter Center, I learned a variety of things such as preparing food bags to sorting out mail. However, the biggest takeaway was gaining a sense of belonging and being able to apply course materials at the Ritter Center. Prior to the Ritter Center, I had no real connection to the city of San Rafael. All that I knew was Dominican and the beautiful neighborhood surrounding it. Belonging to me means that you are giving back to the community you live in. Choosing to do my service learning at the Ritter Center changed my entire perception of San Rafael. It had never crossed my mind that a beautiful place like San Rafael had a population that was living in poverty. Maybe I was being naive, but after weeks of going to the Ritter Center, I realized that the majority of the homeless individuals had some sort of health problem. Going into a new community, I had no real connection with Marin County. However, doing my service learning at the Ritter Center gave me this sense of belonging because I was doing something that was going to help the community in San Rafael. The Cultural Anthropology Service Learning course helped me find a sense of home here in Marin County. The service learning part of the class really allowed me to dive into the course material. My anthropological engagement with the Ritter Center has allowed me to combat the silo effect because I had never been exposed to factors leading to homelessness. The silo effect is when there is no communication between sections in one larger corporation, leading them to fail. In society, the silo effect would be all the issues that as a society we refuse to talk about. Due to the fact that these issues such as income inequality, mental health, and addiction are silos, it is easy for society to judge these homeless individuals. Interacting with the volunteers at the Ritter Centers and their clients has allowed me to see that silos such as mental health, addiction, and income inequality have to be spoken about in order to understand the root causes of homelessness. It can be extremely difficult when the resources necessary to get better are not provided and is dealt with by ignoring these problems instead of giving the homeless individuals the help that they need. Another concept that was covered by my cultural anthropology class was mental maps of reality. Mental maps of reality are cultural classifications of what kinds of people and things exist and the assignment of the meaning of those classifications. My mental map of reality of the homeless was shaped similar to what society thinks of the homeless population. I thought they were lazy individuals with no motivation to work. I knew that I had fallen into the traps of silos and mental maps of reality that society has on homeless individuals. The course material, along with the numerous interactions with the clients at the Ritter Center, allowed me to see that you can't judge an individual by their appearance. While I had my previous assumptions on the homeless population, I was able to put those assumptions aside. Once I put my assumptions aside, I was able to understand the underlying factors of homelessness on a much deeper level. Some underlying factors of homelessness I came across were income inequality, no affordable housing, and the lack of health care. Since they have been placed in mental maps of reality of being drug addicts and unstable individuals, people oftentimes don't want to help them. It is easier to assume the worst than know what leads them to be in the situation that they are in right now. With the short amount of time that I was at the Ritter Center, I realized that they really are trying to get better. They are doing things by utilizing the programs that the Ritter Center offers, such as primary health care and recovery programs to help them get back on their feet. They are grateful for the resources that they are provided and never once had said or done anything disrespectful towards me. I get excited and happy to see that the clients continue to get the help that they need to get better, and I was able to help. The Cultural Anthropology Service Learning course allowed me to understand the root causes of homelessness as well as finding a sense of belonging, and for that I am extremely grateful.